Hematology. The study of blood is called as hematology. In Greek word, hem is called as blood. A person's health or disease can be denoted by the blood. It includes, hematology includes blood and blood forming organs and proteins involved in the bleeding and clotting time. Hematology is the branch of medicines which concerned with the study of cause and treatment and prevention of the disease which related to the blood. It involves treating diseases that affect the production of blood and its compounds, such as blood cells, hemoglobin, blood proteins, bone marrow, platelets, blood vessels, spleen, and the mechanism of coagulation. Such diseases might include hemophilia, blood clots, other bleeding disorders, and blood cancers such as leukemia, multiple myeloma, and lymphoma. These are the some diseases of which related to the blood. And hematological tests can be evaluated by the numerous conditions that involve blood and its components. They can be used to diagnose the inflammation, anemia, infection, hemophilia, blood clotting disorders, and leukemia, and to respond the chemotherapy. Among the all things, the clinical interpretation of the hematology is hemoglobin. First of all, hematology includes hemoglobin, RBC count, WBC count, and clotting time, bleeding time. It will include in this hematology. The hemoglobin. Hemoglobin is a oxygen carrying protein which is in red colored substance. The globulin is the protein, and in adult males the 14 to 18 grams of hemoglobin is presented. In adult females 16 grams of hemoglobin is present. Increased hemoglobin, it can cause the dehydration, chronic obstructive pulmonary disorders, and congestive heart failures. Where it decreases, it causes anemia, blood loss, liver diseases, etc. Next one, RBC count. The red blood cells are responsible for the transport and exchange of the oxygen. Measurement of RBC is important to monitor the effect of blood loss and chronic diseases. In adult male, 4 to 6 million cells of RBC cells are present in the blood. In adult female, 3 to 5 million RBC cells are present in the blood. While it increases, if in case of the RBC cells are increased, it causes anxiety, stress, and bone marrow failure. While it decreases, it causes chronic obstructive pulmonary disorder and anemia, blood loss, and many cancers. In addition to the white blood cells, the complete blood count can include to evaluate size, weight, shape of those cells. The white blood cells are also called as leukocytes. These leukocytes are classified into granulocytes and agranulocytes. The normal range of the white blood cells are 4,500 to 11,000 cells per millimeter cubes. High value can be caused by the leukemia, polycythemia, and some infection diseases. These white blood cells can be differentiated by the bone marrow depression and aplastic anemia. The granular and non-granular leukocytes are counted and its value are expressed as total white blood cells. neutrophils, basophils, eosinophils, lymphocytes, monocytes, mean cell volume, mean cell hemoglobin, erythrocyte sedimentation. These are all comes under into the white blood cells count. In normal human being, the 2 to 3% of neutrophils are presented, and the normal value of basophils in human beings are 1%, and in white blood cells 5% of eosinophils are presented, and 30 to 40% of lymphocytes are present in the white blood cells. 3 to 7% of monocytes are present in the white blood cells. The erythrocyte sedimentation rate. In this erythrocyte sedimentation rate, the increased viscosity of blood slows down the sedimentation rate. While viscosity of the blood decreases, the sedimentation rate of the erythrocytes will be increases. After that, bleeding time. The normal bleeding time in human beings is 2 to 7 minutes. Any clotting factor deficiency or any platelet abnormality will lead to increase the bleeding time. To control the bleeding time, we have to take some measures, and prolonged bleeding time can cause thrombocytopenia, acute leukemia, aplastic anemia, liver diseases, etc. And another one is clotting time. Where it comes to the clotting time, the normal clotting time of human being is 4 to 14 minutes. The measure of the time required for the formation of first clot can be screening test for the coagulation disorders. Platelets are essential function in the blood clotting. There are 150,000 to 450,000 platelets are present in the blood. The blood platelet count will be increased in blood. It will cause infections, trauma, and some malignant cancers. While the platelet count will be decreased, it causes alcohol toxicity, anemia, blood loss, infection, many congenital conditions. Urine analysis. What is the urine analysis? The analysis process which is performed on the urine. A urine analysis is a laboratory test. It can help your doctor to detect the problems with your body that may be indicated by your urine. Many illnesses and disorders can affect how your body removes the waste and toxins. The excretory system includes lungs, kidneys, urinary tract, skin, and bladder. These problems with any of the body parts can affect the appearance, concentration, and content of your urine. Urine analysis is not the same as a drug screening or pregnancy test. Although the urine samples can be taken, and that urine samples are checked under the microscope. This urine analysis is done for to know the any other type of why this urine analysis is done in human beings. This urine analysis is used to prior the surgery and to preemptive screening during the pregnancy checkup, and it is a part of routine medical and physical exam. Your doctor may also order urine analysis if there any suspect that you have certain conditions such as diabetes, kidney diseases, liver diseases, urine tract infections. If you are already been diagnosed with any of these conditions, your doctor may use urine analysis to check on the progress of the treatments to know the disease. Your doctor maybe also want to do a urine analysis if you experience certain symptoms like abdominal pain, back pain, blood in the urine. In those cases, the urine analysis is performed by the doctors. Interpretation of the urine analysis can be done by the urine color and smell, urine transparency, dipstick urine analysis. Urine color. Normal urine color is described as straw or yellow or amber color. This color may be altered by the medications or food sources. Like while we are taking vitamin tablets, the urine becomes yellow, dark yellow color. And while the red urine may be due to the blood or hemoglobin or beetroot. Iron supplementary may cause the breakdown of specimen and it causes the urine transparency. Cloudy urine may result in from the injection in the presence of blood cells or bacteria or yeast. Foamy urine may be indicate either presence of glucose or proteins. The smell of urine is described as urinoid. Some other smells, which is fecal smell, fistula, or smell of ammonia, smell of asperges, they all can be leads to the disorder or abnormality of the urine. Urine transparency. A fresh, voided urine is clear and transparent. Cloudy urine may be caused by the crystals, deposits, white blood cells, red cells, epithelial cells, etc. And the substances which cause cloudiness but they are not considered unhealthy include mucus, sperm, prostatic fluid, and cells of skin, urine crystals, and some contaminants. Dipstick urine analysis. In this dipstick urine analysis, specific gravity of urine is measured for the amount of solutes which dissolved in the urine as compared to the water. The specific gravity measures the ability of kidney to concentrate or dilute the urine and which is directly proportional to the urine osmolarity. Specific gravity between 1.002 to 1.335 is a random sample is normal. IF kidney functional is normal. While it is decreased, it causes inability, which is causes nephrogenic diabetes and falsy low specific gravity can be associated with the alkaline urine. And increased volume of the specific gravity, it can indication for the dehydration and elevation of the diarrhea. This is about the dipstick urine analysis. And the pH of the urine is normal urinary pH range is between 5.5 to 6.5, but it may be vary from low to high, that is nothing but 4.5 to 8.0. The glomerular filtrate of the blood plasma is usually acidified by the renal tubules and collected ducts from the 7.4 pH to 6 in the urine. While the urine having high pH, it causes alkali urine. In that cases, we have to use the amphotericin B, carbonic anhydrase and acetazolamide drugs. While the pH of the urine will be low, it causes acidic urine. We have to take high protein diet and it can be cause for the diabetes mellitus or diarrhea. Thanks for watching.